Hi, everyone. This is Felicia Brown with One Concept Radio, where I'm getting to know experts and educators from the massage, chiropractic, acupuncture, and spa professions. Today, I'm here with Drew Freedman. Drew Freedman is the owner and founder of the Boston Bodyworker and a graduate of the University of South Florida Sports Medicine program, as well as the Suncoast School of Massage Therapy. Drew is also the founder of a new website portal for clinical bodyworkers called letsgetclinical.com, which offers bodyworkers thousands of articles and videos from some of the industry's very best educators, such as Eric Dalton, Whitney Lowe, Leon Chaitow, and many, many more. Welcome to the program, Drew.
Hey, Felicia. Thanks for having me on today. I really appreciate you taking the time.
Well, we're excited to have you here, and of course, so glad that you're a part of the One Concept conferences. We really appreciate all you do for us.
Well, it's been fun. I've been going to the last couple of conferences over the last few years, and it's just a great group of people to be around, and the environment is just rich for networking and meeting just other passionate people like ourselves that, love to give back to the profession. So I'm happy to be a part of it.
Well, likewise, I know exactly what you mean. And today I'd like to talk to you about a few different things related to the classes that you teach at these conferences. Specifically, we're talking today about kinesiology tape. So let's start by just having you share a little bit about your background and how you got involved with massage and kinesiology tape.
Well, as you mentioned in the beginning there, I was formerly an athletic trainer at the University of South Florida, and during that time, when I was on the road with my team, the only thing I really had available to me were my hands and the hotel ice machine. So I started getting into massage way back then. And then, of course, it spun into saying I wanted to do this full time, with just treating people with my hands. And I slowly but surely learned about other taping methods, from my use of McConnell tape or other prophylactic tapings. But I started to learn about kinesiology tape and how that works and how it can benefit our patients as well in conjunction with our body work. And I've been doing that since maybe 2005. I think I started with kinesiology taping, and I got certified by the Kinesio Taping Association in 2007, and I have been doing it ever since then. I then recently, in the last few months, have jumped on and partnered with 3B Scientific, which is the maker of 3B Kinesiology tape, and to help them kind of promote their products. So I'm no longer certified through the Kinesio Taping Association because that would be a conflict of interest, obviously, but I'm happy to be working with 3B and helping them promote this tape, which I've found to actually be equally as resilient and effective as the Kinesio tape and all the other imitators that are out there on the market today.
Well, and you talked about it being as effective, but I know there's some people listening that may not really understand how kinesiology tape works. So can you explain that?
Sure. So kinesiology tape at its foundation is designed to really lift the skin slightly, about 10 microns is what they say it really lifts the skin. And what it does by lifting that skin over the area that's being treated, it allows for some space to be created in that interstitial space where the lymphatic fluid and blood floats through the area. So it helps the body do what it's trying to do naturally, which is to heal itself. So by doing that and moving the fluid through the area, the body is able to kind of regenerate the tissue that needs to regenerate in there. It takes some pressure off the pain receptors in that area, therefore decreasing pain and decreasing inflammation. So it's extremely effective, just at its light, what they call paper off tension use. And then, depending upon how you use the tape, you can vary the tape with different degrees of tension, and the degrees of tension vary based upon what you're trying to accomplish with the taping technique. Versus, say it's something like a muscle strain or it's a muscle inhibition. So depending upon the direction that you pull the tape and the amount of tension you apply to the tape is really how the tape becomes most effective. But I've also emphasized with my classwork is that the tape is effective as a standalone modality, but works even better when used in conjunction with body work like, massage therapy or chiropractic or even PT. Because it's just taking your work that you've done with your patient and allowing you to apply the tape and letting your work hold for that much longer. So it's a lot of times the patient will say, it feels like I'm taking your hands with me, which is not necessarily a bad thing.
That's true. Well, so you can do it in conjunction with those things. Is it something that you would do instead of massage or chiropractic?
It depends. Like, if somebody comes into me and they have a they have an acute ankle sprain, I probably wouldn't do too much massage in that area in the time being, but I would apply a lot of the kinesio tape, the lymphatic tape into the area to reduce some of the swelling into the area, but also to maintain some sort of mobility in the area as well, because you don't want that tissue getting too splinted up. So sometimes I would use it separately. Other times I've used it just isolated as just taping when somebody's maybe going out to run a road race. In that regard, where they maybe had bodywork in the past, but now for the road race, they want me to tape their IT band or some shin splints. But typically I've done some bodywork with them in the past, and the taping is just something they're using for that weekend. But I use it both ways, but primarily I try to encourage patients to do both the bodywork and the taping to have the most effective long-term result from it.
Awesome. Well, that makes a lot of sense. And, when you're talking about athletes and the applications for shin splints and everything, I totally get that. I've talked to you about it before. I do these short distance triathlons, and in the course of training, it seems like something's always hurting. And I've used taping, I don't know which brand, I'm sorry, one kind of the brands of tapes and somebody's technique to tape my own shin splints, and I could definitely tell a difference. But I'm wondering, is this something that's just for athletes? I mean, who else can benefit from kinesiology taping?
No, that's an excellent question, because I think, a lot of people, especially in the last 4 or 5 years, they've seen kinesiology tapes become more and more as a visual kind of concept at sporting events like the Olympics and pro sports. So they immediately think, well, in order to use this, you probably need to be an athlete. And it's not true. That's just the population that seems to be, you're seeing it more of. But you'd be surprised how many people are walking around Boston with kinesio tape on their bodies, and you would never know it. And they're just, computer athletes, we'll call them. But they're using it for postural changes that we're trying to apply with the bodywork that we're doing at the practice. So the tape is really designed to be used on anybody. It just depends upon how it's being used for each individual person. Now, with athletes, it's obvious you're going to be using it, for their performance during their activities. But for some stretches at a time, and they're having some upper cross syndrome or some lower cross syndrome stuff, and you can use that tape to help create the proprioception that's going to get their body to get back into alignment the way they want it to be, and allow them to kind of be pain-free throughout their workday.
So what are some of the most specific conditions, or the most common, rather, conditions that you end up treating with kinesiology tape? Let's make sure we use the right one. I know the monikers are all different for the different brands. Kinesiology.
Yeah, I will make mention that, obviously, kinesio tape was invented by Dr. Kenzo Kase, who's just a brilliant man. He's a chiropractor. He invented this tape about 30 or so years ago. And along with the tape that he created, he also created the kinesio taping method. But since then, as they say, imitation is the sincerest form of flattery. There are a lot of different brands of kinesiology tape that are on the market. I prefer to use now 3B tape, but that doesn't mean I have anything against kinesio tape. I think they're all very effective. I think where the difference comes in is the applicator. It's when you apply this tape, it needs to be applied correctly. And by correctly, I mean the surface needs to be cleaned. It has to be free of any dirt. You can't tape over, I have hairy legs. You can't tape over my hairy legs. They need to shave that area if you're going to be applying the tape. And then the degree of tension applied to the tape. So typically it's not the tape that isn't effective. It's the applicator of the tape that is ineffective. Right. So I always like to emphasize that.
That's very politically correct.
What's that?
I said that's very politically correct of you.
Yeah. As far as the applications that we commonly use, in my practice, again, we see a lot of cubicle dwellers, but we use a lot of athletes. We see a lot of athletes as well. So we'll tape a lot for shin splints and ITB friction syndrome and shoulder strains and rotator cuff injuries, cervical whiplash, injuries. But we'll also be treating people for, like I said, the upper cross and lower cross syndromes that we're trying to assist them with. So a lot of times we'll use the tape just to create some communication with the brain and the body, with creating some proprioception and some tension on the body in those areas where we need those muscles to kind of either, relax or lengthen, one or the other, depending upon what their state is. So we'll use them for a variety of different conditions. And once you understand the basic principles of the tape, you're really unlimited as to what you could do with it, because the tape is so versatile. Sometimes it's trial and error. I mean, I'll just geek out with something. I say, listen, I've never taped for this before, but in theory, this should work, so let's try it. And you try it. If it doesn't work, you'll know within a few minutes when you tape somebody that you tape them incorrectly because they'll typically sense some sort of discomfort from the taping. I will say that most people, when they tape, even when they do it on their own and they can buy it at the store now, they'll over apply the tension. They'll think just a little bit more because I want some support.
Right.
The tape isn't made to do that. If you pull the tape too tight, really past what its 50% available tension is, you're starting to lose some of the tape's ability to recoil. And when you start to do that, you're basically diminishing the effectiveness of what the tape is designed to do. So I always caution people that if you're not sure what the tension is, err on the side of less. You can always add more tension later, but if you do too much, you could really throw up some of the systems that you're trying to correct.
In other words, less is more.
Exactly. Less is definitely more. Because, as an athletic trainer, I was always taught, with those white McConnell tapings to really just splint it up and tape it as tight as you can and wrap it as hard as you can. And I had to kind of unlearn all of that so I could correctly apply this tape. And I'll admit, it took a little bit of, monkeying around in my brain to make sure the concept worked out. But once you understand the function of the tissue, understand your origin and insertions of your muscles and the movement of a joint, then applying the tape seems to correlate and make sense to you now that you understand what it's going to do in conjunction with what the body's trying to do. You're not trying to prohibit the body from doing something. You're trying to assist it in doing what it wants to do.
Yeah, it's all making sense to me, and I've certainly benefited from kinesiology taping on a couple of different occasions. But I will admit it sounds a little complex. So I'm wondering, will students that come to your classes be able to apply what you're teaching immediately into their practice, or are they going to need to get certified first?
Well, for the class that I'm teaching in Canada, it's a 3-hour workshop. So, to say that they're going to be able to leave there and they're going to know everything they need to know about kinesiology taping would be bogus to claim that. So in the 3-hour workshop, what I'm really trying to do is afford them the understanding and the knowledge of what kinesiology tape is, how it functions, why it functions, and how to, in theory, apply the tape. And during the class, I'll teach students how to apply 2 or 3 different types of tapings to, like, say, a hamstring injury, like a light hamstring strain, maybe a calf strain, maybe a postural condition that they want to fix. And I'll give them those techniques to take into their practice. They can easily apply because, again, it's just a matter of thinking about it. Do I want to pull the tape from origin to insertion or from insertion to origin? Do I want to make an X cut or a Y cut? And those are the stuff we'll be teaching in that 3-hour class. But to be truthful, there's hundreds and hundreds of more techniques and applications to use with the tape that would certainly require many more hours of learning. Currently, right now, the only, certifying body that I think actually holds its weight right now is the Kinesiology Taping Association. Certainly you can get certified through them, but I'm working with 3B right now to create our own certification process that we can help students get certified with using the 3B tape just the same.
Fantastic. Well, that sounds like something to look forward to. And I know, Drew, that people are going to want to learn more about that program as it develops and may want to get in touch with you prior to or after the conference. Could you please share your website or best contact information with everyone listening?
Sure. Like I said, I'm the owner of the Boston Bodyworker, so they can find out more about me and the Boston Bodyworker at bostonbodyworker.com. Or they can, if they want to learn more about a lot of different things with the massage world, they can go to letsgetclinical.com and they can find out more about me and a lot of different presenters that are on there, such as yourself, that they can learn more about. And they can reach me at either one of those. So it's Drew at bostonbodyworker.com or Drew at letsgetclinical.com. Everything comes to me. I'd be happy to answer any and all questions that come my way. I try to respond to emails as quickly as possible. But otherwise, I really hope people come out to the class. We're doing a 1-hour free introductory class on that Friday. I believe it's at 12:30. And then on Sunday, I'm teaching a 3-hour at 12:30. So I know that we have spaces are filling up, but I think there are still some spaces available for the Sunday class. But it should be a lot of fun. I'll also show people during the class how to market with kinesiology tape, because when you go to some of these events that you want to market your business with, kinesiology tape is a great eye catcher for your business. People walk around with this tape and say, hey, where'd you get the tape? Because it's all pink and blue and yellow. It's a great thing for people to see that Boston Bodyworker applied this tape, and they'll learn more about you, and it'll kind of burn into their brain a little bit more too.
Well, you know I'm all about the marketing, so that's good to hear.
Yes.
Good little tip. Maybe we'll have to pack that information into my class somewhere. Free. How do you do some free marketing for yourself? Put kinesiology tape on your clients. Maybe you can send me a picture. Yeah, you ought to send me a picture.
Well, so like I say to the students too during my classes, I'll put up some pictures on there and using the kinesiology tape. I have two little girls. I have an 8-year-old and a 5-year-old. So I always say is there any way to expose your business by using something that's colorful and fun and exploiting your children, go for it. So I just tape my kids and I put them out there with their 26.3s on their shirt and the kinesia tape on their legs.
Fantastic. Well, it's a great marketing tip. I definitely will be sharing that with people in the future. And for you listening, if you would like to learn more from Drew Freedman, please plan on joining us for the One Concept Canadian Massage and Chiropractic Conference in Niagara Falls, Ontario, October 18th through 20th. Just go to www.oneconcept.com. That is the word one, O-N-E, concept.com for more information and to register. Thanks so much for tuning in and have a fabulous day.